Namaste everyone, I am Dr. Amit here. Welcome back to my YouTube channel at the rate Dr. Amit Official. So your place for simple and high impact medical learning. So if you haven't subscribed yet, make sure to hit that subscribe button and stay connected for more such videos. So in our last video from microbiology series, we talked about Clostridium difficile in the last video. So in this video, we are going to talk about Clostridium tetani. So this is one of the exam favorite topic for USMLE, PG and MBS exam, and explain it in a simple, clear and exam oriented way so you can understand it easily. So stay focused and let's get started with our today topic Clostridium difficile. And don't forget to follow my YouTube channel at the rate Dr. Amit Official. So let's start our today topic Clostridium tetani. Okay. So talking about the lab feature of Clostridium tetani. So it is a gram positive anaerobic spore forming bacillus that is rod shaped. Okay. So where this Clostridium tetani actually found? Okay. So it is found in soil, then rusty object and animal feces. Okay. Now the classic line is rusty nail injury. Okay. So whenever you find this line in any question, so always think about tetanus. Okay. Rusty nail injury. Okay. So actually the pathogen, I mean Clostridium tetani is non-invasive. Okay. It remain localized to the wound site. Suppose if here is the wound, then the pathogen will keep localized. So suppose if here is the wound, okay, then the pathogen will remain localized at the wound site. Okay. So now let's talk about the virulence factor of Clostridium tetani. Okay. So talking about the virulence factor, okay. So this Clostridium tetani produces two types of toxins. The virulence factor of this Clostridium tetani is tetanospasmin. Okay, the toxin produces tetanospasmin. Okay, and it is an exotoxin that causes actually tetanus. Okay, and always remember this tetanospasmin is a neurotoxin. Okay, it's mainly keep toxic effect to the CNS. Okay, neurons. Okay, that's why it is also called as neurotoxin. Okay, now let's talk about the mechanism of action of this tetanospasmin. So talking about the mechanism of action, okay, of this toxin. So the tetanospasmin spread retrograde means what? In the backward flow, okay. So spread retrograde axonal transport, okay. Then after going retrograde, it reaches to CNS, okay. And over CNS, in CNS, it blocks GABA and glycine. We'll talk about GABA and glycine separately, okay. From the Rensa cells and by cleaving snare protein involved in neurotransmission. Okay, so this snare protein actually involved in transmission of the transmission of anything in the neurons. Okay, so they cleave this protein, okay, and they block this GABA and glycine. Okay, so now let's talk about first GABA, then glycine. Okay, so while talking about GABA, so GABA is actually GABA aminobutyric acid. Okay, it's an important inhibitory neurotransmitter in the brain. Okay, actually it inhibit, okay, any activity which is more going on. Then the main activity of GABA is to inhibit. Okay, so make neuron less excitable. If the neuron start being more excitable, then this GABA will stop that neuron to become less excitable. So now let's connect how this GABA correlate with tetanus. Okay, so the toxin block GABA. We all know how the toxin is blocking GABA. So now the toxin blocks the GABA. Okay, then there will be no inhibition. Okay, suppose now the neuron is more excitable, then no one is there to block the activity of this neuron because GABA is blocked. Okay, so that's why the neuron will keep continuous stimulation. Okay, so that will result in muscle contracting. Okay, the muscle keep contracting because no one is there to stop this stimulation. Okay, so the muscle will keep contracting and that will result in spastic paralysis. Okay, so this is how the GABA is related to tetanus. Okay, now we'll see about glycine. Now while talking about glycine, it is important in spinal cord. Okay, so the glycine inhibits motor neurons. Okay, so how it is connected to tetanus? So the toxin, we all know the toxin block GABA and glycine. So the toxin also block glycine. So the glycine has been blocked. Then again, there is no inhibition to the motor neurons. So it finally result in spastic paralysis. Okay. So this is about the mechanism of action, that how tetanus, Clostridium tetani cause tetanus. Okay, tetanus specimen spread retrograde, then it reaches CNS. There it blocks GABA and glycine, and after blocking GABA and glycine, it causes spastic paralysis. Okay, now we'll talk about the clinical presentation of tetanus. Okay. So while talking about the clinical presentation, okay, the first one is spastic paralysis. We all know now how spastic paralysis occur in a patient. Then the trismus. Trismus is actually what? This is a locked jaw. Mean difficulty in opening the mouth. Okay. Then recess sardonicus. It means the eyebrows of the patient is raised and with an open grin. Okay. And the third clinical feature is opisthotonus. That is spasm of the spinal extensor. Okay. Now let's understand the clinical feature, presentations from this. Okay, so this is trismus. Okay, okay, so the jaw is locked. Okay, so just remember this figure. Okay, trismus means locked jaw. The jaw is locked and the patient will have difficulty in opening the mouth. Okay, then second one is recess sardonicus. Okay, I've already told you the eyebrows are raised, right, and with an open grin, right. Now the third one is spastic paralysis. Okay, you can see that all the muscles has been rigid. Spasm is there. Okay, spastic type paralysis. Now the third one is opisthotonus. Always remember, if the patient is making curve in the backward direction. Okay, so you can see the patient is making curve in this direction. The arc is making like this. Okay, so this is a opisthotonus position. Okay, so always remember the tetanus symptoms. Always remember this figure. Okay, the trismus, recess sardonicus, spastic paralysis, and opisthotonus. Now we are done with clinical presentation, right? Now we'll talk about diagnosis. So diagnosis is mainly clinical. Okay, always on the basis of clinical presentation we'll diagnose the case. Okay, now coming to a treatment part. Okay, so always treat with antitoxin. Okay, and you can give booster dose of the vaccine. Okay, the first line. Then how we need to neutralize the toxin. Okay, the toxin produced, that is tetanospasmin. Okay, so to neutralize the toxins we give tetanus immunoglobulin. Okay, now we all know it's a gram positive anaerobic bacteria. So to kill the bacteria we need to give antibiotics. So antibiotic will be metronidazole. Okay, so to neutralize toxin we give tetanus immunoglobulin. Now to kill the bacteria we need to give antibiotic, that is metronidazole. Now we all know that there is spastic paralysis, that spasm is there. So to control the spasm we give diazepam from the benzodiazepine group. Now we also need to give some supportive care, like we need to do airway management. Okay, wound debridement and ICU care. Okay, and if someone need prevention. Okay, so for prevention we give tetanus toxoid vaccine. Okay, so I think this is all about the Clostridium tetani and the tetanus. Okay, so this much is enough to solve the MCQs in the NMCL exam, USML exam, postgraduate entrance exam, and MBBS professional exams. Okay, so if you like this video, please share with your fellow medicos and don't forget to subscribe my YouTube channel at @Dr. Amit Official. Thank you for watching. Thank you.